Hello, welcome to the What's What Shoulder Care Meetup. My name is Stephen Wickham. I'm a health fitness professional, and this session is educational only and not intended to provide medical advice. Let's test your knowledge. How many different bones make up the primary shoulder joint? The correct answer is 3. The humerus, which is the upper arm, the scapula, your shoulder blade, and the clavicle, your collarbone. The top part of the upper arm bone has a ball that fits into the socket of the shoulder joint, forming a ball and socket joint. These bones are surrounded by many muscles and tendons that hold them in place, also known as your rotator cuff. The shoulder is the most mobile joint in the body. While the shoulder is the most mobile joint in the human body, its ability to move in so many ways makes it prone to injury. It's also connected to the back and neck. That's why it's important to maintain your strength and stability in the joint. Most shoulder problems are linked to soft tissue, the tendons, ligaments, and muscle that are in the shoulder. There are several things that can cause shoulder problems. First, overuse or repetitive motion using the joint too much or doing the same movement over and over again. Injuries from poor posture, for example, this could happen in work, at play, or even during activities such as cleaning the house or doing yard work. Trauma, such as falls, sports injuries, fractures that affect the shoulder, especially where stretching out of the arms to break a fall. Arthritis and other health conditions that cause degeneration of the tissue in the joint. Many shoulder problems affect the soft tissue, your muscles, tendons, ligaments around the shoulder joint. For example, bursitis, inflammation or swelling of fluid-filled sacs that cushion the joints. Tendinitis, inflammation in the tendons that connect the muscles to the bones. Or there's also rotator cuff injuries. Dislocation can happen when the bones are either partially or completely out of the socket and may happen more often if the soft tissue in the shoulder are loose or torn. Dislocations may happen suddenly from overuse of the joint. There are several things you can do to help prevent shoulder problems. First, listen to your body. Don't overdo it, whether it's in sports, weightlifting, lifting objects, or an everyday task. If you feel pain, stop. Warm up before physical activity to get your muscles ready to move and reduce the risk of injury. This includes not only exercise, but physical activities such as cleaning the house, gardening, work-related job tasks. Be active on a regular basis and add more activity time and intensity gradually. For example, learn how to lift weights correctly and don't add too much weight too soon. Not sure how to get started? Ask a wellness zone staff for help. Use proper posture and be aware of your posture during all activities. Learn to use proper form when exercising, including strengthening, stretching, cardio, yoga, Pilates, or any form of exercise. Remember your reach zone when planning your work and tasks. As much as possible, keep tasks in the ideal reach zone as noted by the green shaded areas. The yellow are okay, but we want to stay out of it and definitely stay out of the red. If you have to perform an overhead exercise, be sure to take frequent breaks. Body mechanics are especially important for preventing shoulder problems. Some simple shoulder exercises and stretches can help. Let's start with the shoulder blade squeeze. Stand tall with an upright posture, placing your feet about shoulder width apart. Put your elbows backwards, squeeze the shoulder blades together. If you experience discomfort, perform this movement more gently. Standing chest stretch. Standing in a corner or doorway, place hands, forearms, and elbows on a wall or a door frame. Place one foot in front of you and gently shift your weight through your arms onto your front foot. You should feel a mild pulling sensation across the front of your chest and shoulders. If you experience discomfort, then perform the movement more gently. Seated thoracic extension. Sit upright in a chair that has a backrest that ends at your mid-back. Place a tightly rolled towel at the top of the backrest. Extend your fingers behind your neck and pull your elbows back. Slowly extend over the back of the chair using a towel roll as your pivot point. Allow your chest to expand while you're breathing as you lean backwards. Should you feel a mild discomfort, please perform it more gently. There are some warning signs about shoulder problems that means it's important to seek medical care. Significant increase in stiffness or decrease in the range of motion of your shoulder, feeling of instability such as that your shoulder may pop out of the joint, numbness or tingling in your shoulder or arm, a significant decrease in shoulder strength that limits your daily activity, pain in the shoulder, neck, or arm. Pain in the arm and shoulder with certain other symptoms can be a sign of heart attack. Some start suddenly and are intense, but many also start with milder symptoms. Other symptoms include chest discomfort, which could be pressure, squeezing, fullness, or pain, upper body pain, one or both arm, jaw, back, or neck, or shortness of breath, nausea, lightheadedness, or breaking into a cold sweat. If you experience these symptoms, please call 911 immediately. What will you do next? Here are some possible next steps to keep your shoulders healthy. Ask about an ergonomic assessment or job site work analysis to help your team properly manage your daily work. Try a simple shoulder stretch, such as one included in the handout. Talk with your injury prevention or fitness professional at the Wellness Zone. Thank you for listening. I hope you found the information useful. Please comment below so we can track participation.